Yeah, good morning, Jake. So that message is really with all the excitement of going back to school, the new supplies and seeing friends. Doctors say the goal is to keep them in school. And one way to do that is to get your kids 12 and up vaccinated. So Dr. Susanna Block is a pediatric hospitalist at Kaiser Permanente and says there is still a lot about the Delta variant we don't know, like long-term effects. But what we do know is it's much easier to spread. So Dr. Block says she is seeing 20% of COVID cases in the last few weeks being in children, and they can give it to each other more easily because they can't get vaccinated. So kids over 10 have similar symptoms to adults. She says body aches, loss of taste and smell. But for kids under 10, they're a little different, and that could mean high fever, runny nose, and a cough. And it can be confusing for parents to tell the difference between a common cold and COVID. More reason, she says, to get them tested often and wear those masks indoors.
Earlier in the pandemic, we may have the sense that COVID is not so dangerous for children. And it's true, it's not as dangerous as it is for adults, but that does not mean that the risk is zero.
Now, another important message the doctor shares, it's almost flu season, so she's pushing to get the flu vaccine as well. She says the last thing she wants to see is a child having COVID and the flu together. For now, reporting live in Seattle, Angelique Kakade, King 5 News.
Very interesting and important point there for sure, Angelique. Thanks. Yeah.